We'll get started in 2 minutes. Reporters on the line, please press 1 to ask a question.
Good afternoon. Happy Friday. I'm Mandy Cohen. I'm the Secretary of Health and Human Services for North Carolina. And today is a special press conference. We have a number of special guests, and I'm joined by Dr. Viviana Martinez-Bianchi, Director of Health Equity in the Duke Department of Family Medicine and Community Health, Pilar Rocha Goldberg, President and CEO of El Centro Hispano, and Juvencio Rocha Peralta, Executive Director of the Association of Mexicans in North Carolina. Karen Magoon and Monica McGee are our American Sign Language interpreters, and working behind the scenes, as always, are our Spanish translators, Jackie and Jasmine Matevier. So first, I'll start with a rundown of the numbers. As of this morning, there were 58,818 laboratory confirmed cases, 892 people are currently hospitalized, and sadly, there have been 1,303 deaths. Throughout our response to this pandemic, we relied on the science and data to guide our efforts to help slow the spread of the virus. The data is very clear that COVID-19 is having a dramatically disproportionate impact on our Hispanic Latinx North Carolinians, as it is across the country. Many in our Hispanic Latinx community provide essential services such as construction or childcare and food processing, industries that are not only the bedrock of our economy in normal times, they keep our state functioning and running while most of us were able to shelter at home. We also know that at the same time, work makes social distancing challenging. Some may not provide health insurance, and it can create a financial burden for someone who is sick to stay at home. One of the many people taking action is Dr. Viviana Martinez-Bianchi. She founded Latin 19, the Latinx advocacy team and interdisciplinary network for COVID-19. I'm also grateful that she's serving on our COVID-19 response team. She's here with us today to share more about the impact of COVID-19 on the Hispanic Latinx community, so I'll turn it over to her now.
Thank you, Secretary Cohen, for the opportunity. My dear Hispanic community, I am here as a Latina, as an immigrant, as a doctor, and on behalf of health workers to let you know that we see you, that we hear you, and that we are concerned about your anxieties and your fears, determined to look after you. We are your doctors, your clinicians, and nurses, and we are concerned about what is happening today with the health of the Latino community in North Carolina. We are concerned about the rising number of COVID-19 in the Latinx community, more and more every day, and now make up the majority of daily cases throughout the state. But why so many cases? Latinx workers, you're essential to the economy of North Carolina. While others were able to isolate at home, you had to go out to work. You work in meat processing plants, in cleaning, in construction, in supermarkets, hospitals, and kitchens. In many cases, without access to personal protective equipment, such as these masks, which are so necessary to prevent the transmission of the virus from person to person. The transmission of coronavirus happened while working shoulder to shoulder all day in your jobs, in the break rooms, and in the cars in which you travel together to work without wearing a mask. And from there to your homes and to your friends, at times whole families contracting the virus. So we are now in a very serious situation in which every person in the Latinx community has to take their health as their responsibility and fight this dangerous virus. The authorities can implement measures, but if we are not aware of the importance of wearing the mask, keeping our distance, and washing our hands, any measure by the authorities will be useless. To those who believe that this is not serious, I ask you please to think about the people who have already died, hard, working, beloved, and missed by their families. For those who are afraid of the virus, you have to take care of yourself. Get tested if you feel fever or flu symptoms, or if a contact of yours has the coronavirus. You need to go to urgent or emergency care when you start to have chest pain, shortness of breath, paleness, and bluish lip color. Do not wait on this. Do not let fear overcome you, because we're going to take care of you and help you heal. If you have diabetes, adjust your diet and insulin or medication to control it, because people with poorly controlled diabetes are at a higher risk of dying from COVID-19. We are immigrants and children of immigrants. We are resilient. We cross borders and cultures so our family and our dream could have a better life. We are an essential part of the economy of this state. We must overcome fear and beat the coronavirus with the confidence and power of an organized community. Let's work together for better health. Yes, we can. And now I'm going to repeat what I said in Spanish. Mi querida comunidad latina, estoy aquí como latina, como inmigrante, como doctora, madre, esposa, hermana e hija, y en representación de los trabajadores de la salud, para hacerles saber que los vemos, los escuchamos, que nos preocupan su ansiedad y su miedo, y que estamos velando por ustedes. Somos sus doctores, sus clínicos y enfermeras, y estamos preocupados por lo que está pasando hoy con la salud de la comunidad latina en Carolina del Norte. Nos preocupan la cantidad de hispanos que se están contagiando con COVID-19 más y más cada día, representando hoy la mayoría de los casos diarios de todo el estado. ¿Pero por qué tantos casos? Trabajadores latinos, ustedes son esenciales para la economía de Carolina del Norte. Mientras otros pudieron permanecer aislados en sus casas, ustedes debieron salir a trabajar. Trabajaron en plantas procesadores de carnes, en limpieza, en construcción, supermercados, hospitales y cocinas. En muchos casos, sin acceso a equipo de protección personal, como estas máscaras, tan necesarias para evitar la transmisión del virus de una persona a otra persona. En esos espacios de trabajo, hombro a hombro, y en los autos con que viajaron juntos al trabajo sin usar la mascarilla, se disparó la transmisión del coronavirus y de ahí a sus casas, a las reuniones con amigos, a las esposas, esposos, los padres y los niños. Y nos encontramos hoy con una situación muy seria en la que cada latino, cada hispano, tiene que asumir su salud como su responsabilidad y combatir a este peligroso virus. Las autoridades pueden implementar medidas, pero si no hacemos conciencia de la importancia de usar la máscara, guardar distancia y lavarnos las manos, todas las medidas de las autoridades serán inútiles. A los que creen que esto no es serio, les pido por favor que piensen en la gente que ya ha muerto, personas trabajadoras y queridas. Para los que tienen miedo al virus, hay que cuidarse, hacerse la prueba. Si tienen fiebre o síntomas de gripes, háganse el test del COVID. O si sabemos de un contacto con que él tiene, de alguien que tiene el coronavirus. Hay que ir a cuidados urgentes o a la emergencia cuando se empieza a tener dolor de pecho, falta de aire, dificultad para respirar, palidez, color azulado en los labios. No se dejen estar, no dejen que el miedo los venza, porque los vamos a atender y ayudarlos en su salud. Si tienen diabetes, ajusten su dieta, medicamentos o insulina para controlarla, porque las personas con diabetes no controlada tienen mayor riesgo de morir por causa del coronavirus. Piensen, si fuera usted el que falta de su casa, ¿cómo se sentiría su familia? Somos inmigrantes e hijos de inmigrantes. Tenemos resiliencia. Cruzamos fronteras y culturas para que nuestras familias o nuestros sueños tuvieran un mejor vivir. Somos parte esencial de la economía de este Estado. Hay que vencer al miedo y al coronavirus con la confianza y el poder de una comunidad organizada. Trabajemos juntos para una mejor salud. Hagámoslo, sí se puede. Gracias.
Thank you so much, Dr. Martinez-Bianchi. We're so pleased that you are here, that you work closely with our team. We have to do better. This week, we further strengthened our ongoing work to slow the spread of the virus and protect workers across North Carolina. As you know, Governor Cooper issued a statewide requirement to wear face coverings in public spaces. And as part of Wednesday's action, Governor Cooper also required workers in food processing facilities to wear surgical masks and required face coverings in other high-risk industries such as construction and farming. We're grateful to those employers who were already doing this for their workers, and we want to see more of it. In addition to prevention actions that slow the spread of the virus, we at the state also continue to ramp up testing. We're focusing on increasing testing in our Hispanic Latinx communities, particularly in areas that have few, if any, testing sites. And we're prioritizing hiring contact tracers who are from the communities that they serve. Of those hired to date, 44% are bilingual. Today, we are also announcing a new partnership with 5 organizations who have been actively engaged in supporting communities during the COVID pandemic and well before. Hispanic Latinx North Carolinians are strong and resilient, and we are investing in that strength. We are committed to working with the people on the ground who know their communities best. So today, we're announcing that we are providing $100,000 grants to MXCAN, True Ridge, Que Pasa, El Centro Hispano, and Latin American Coalition of Charlotte so that they can further increase their impact. I'm grateful to have representatives from 2 of those 5 organizations with me today to talk more about this important work. I'll first recognize Pilar Rocha Goldberg from El Centro Hispano.
Thank you so much, Secretary Cohen. Buenas tardes a todos. Good afternoon, everybody. I am Pilar Rocha Goldberg, President and CEO of El Centro Hispano. We are a Latino nonprofit organization dedicated to strengthening the community, building bridges, and advocating for equity and inclusion for Hispanics, Latinos in the Triangle area of North Carolina. During this pandemic, at El Centro Hispano, we are taking every possible precaution to protect our people. Social distancing, teleworking, mask wearing, frequent hand washing, and much more. We are also doing everything we can to support our community, who have been hit hardest by the pandemic and whose jobs, many of them consider essential, are making it possible for the country to continue to function during the pandemic. The number of calls to our offices has tripled since the middle of March. We have answered almost 2,000 calls, and 800 follow-up calls have been made from our Ventanilla de Salud in partnership with the Mexican Consulate. Almost 600 people have received information related to COVID in the Mexican Consulate, and an additional 600 people have received medical services in our mobile health unit with Libot Consultorios. Thanks to the outstanding work of all the members of our team, and thanks to collaborations, partnerships, and private donors, we have helped around 1,400 families with food for a total of 5,600 people, of which 2,800 are minors. Along with the food, we have been delivering cloth masks that we bought from 15 local artisans or have been donated. We are helping approximately 300 families with rent and utilities. We continue to support 100 people with our education programs and connect with 140 members in our support groups. Our social media and website have focused on COVID-19 prevention in the Latinx community, which reaches around 140,000 people every month. Together with the North Carolina Hispanic media, we launched the NC Unida contra el Virus campaign, which aims to send unified messages to the at-risk Latinx community to raise awareness about COVID-19 and reduce contagion. As of today, 22 organizations, including local nonprofits and some local government agencies, have joined this initiative. We have been working hard, but we still have a lot to do to support the Latinx community. Only together, as a community, we will be able to overcome these challenging times and also to tackle its profound consequences. It is why this collaboration and this funding from the state is so important to continue our work. On behalf of the board and the staff of El Centro Hispano, we want to thank the Governor, Secretary Cohen, and Cornell Wright from the Office of Minority Health and Health Disparities for recognizing the needs of the Latinx community and for partnering with nonprofit organizations who have the boots on the ground doing the work. Thank you for helping us to continue serving our local community. Muchas gracias.
Thank you so much, Pilar. And now I'll ask Juvencio Rocha Peralta from MXCon to say a few words.
Good afternoon, and thank you so much, Secretary, for allowing me to use this platform to share not only the extent of MXCon, but insights into the point of the view from the Latino community in the state of North Carolina. Again, my name is Juvencio Rocha Peralta, and I'm the Executive Director of the Association of Mexicans in North Carolina. For more than 20 years, MXCon has been serving the Latino community in North Carolina through a framework of culture, leadership, health, advocacy, and education. More so now during this pandemic crisis compared to previous natural disasters, with despite that the Latinos are so disproportional effect, but I see a unique opportunity to overcome the systematic barriers between the Latino community and the state and the local government. While this community is historically invisible and silent for governments, the fact that Hispanic and Latinos, only 10% of the population, account for 46 of confirmed cases, indicates that now is the time to amend the distrust and lack of connections. Now is time through our working together to resolve this COVID pandemic. Situations to build and support, identify, and connect communities in order to comprehensively prepare for the next natural disasters. I'm incredibly optimistic about this possible based on the work already is in progress and the opponents' work understanding the Latino position in North Carolina. To close my remarks, I would like to connect MXCon's 5-tier frameworks that I mentioned before. We now, a Latino oriented process could work. First, for culture and health, and recognizing that North Carolina is a multicultural state with many towns, many counties, and regions having a sizable Latino population. And any approach to anticipate the public health needs of these communities, not to react for education, critical information, to be available in Spanish and accessible to those in rural areas. And trying with the advocacy and leadership includes appointment Latino individuals, businesses, organizations, and the effort can ensure this. Again, I want to thank you for your time and congratulate the efforts that now as we're moving forward, and especially to assign resources to tackle the situation of the pandemic. Thank you.
Well, thank you, Juvencio, and thank to all of you for being here. Really important messages for our Hispanic Latinx community shared today. But with that, we will turn it over to your questions. Thank you.
For our reporters on the line, we ask that you press 1 if you have a question, and then 5 if you have a follow-up. We'll take our first question today from Victoria Bulavesis with Enlace Latino NC.
Hi, thank you so much, Secretary Cohen, and everyone for being here. I wanted to follow up on something that Ms. Pilar Rocha Goldberg from El Centro Hispano mentioned about families being unable to pay rent. I'm wondering if part of this initiative would also include money going to Hispanic families who can't pay rent due to job loss, or maybe even a state fund that would support the families who don't qualify for unemployment benefits and also haven't qualified for the federal stimulus.
Well, thank you so much for the question. I think that we've been talking a lot about testing and doing contact tracing, but an important component of making sure that we fight this virus and slow the spread is making sure that someone, if they have COVID-19 or have been exposed to COVID-19, can stay home. And that choice is not always available to all of us in the same way. And we know, particularly in the Latinx community, that can often mean the choice between being able to pay rent or put food on the table. And I think this is a first step, working with some of the organizations that are close to the ground and able to work directly with the communities. I think you were hearing about how they are already doing some of this. We wanted to support this further. But from the state perspective and the county perspective, we're also looking to ways in which we can leverage additional federal dollars and state dollars to help around housing in particular. A number of our counties are already taking advantage of what something is called non-congregate shelter, or opportunities for folks to help them isolate if they're not able to in the housing situation that they're in. But much more needs to be done in this space, and I think that's what you are seeing and moving forward today with this partnership with these 5 organizations. But I don't know, would you want to say any more about what you planned?
Thank you so much for the question, because as we know, sometimes there are funds available, but it's the process to get those funds are very cumbersome for our community. So this is when we come into play to really help local governments and other organizations or foundations to do the work, so we make sure our community can tap into those resources and have really the help they need.
Great. Thank you, Pilar. Thanks for that question.
Our next question is from Brian Anderson with the Associated Press.
Gracias por su tiempo a todos. Me llamo Brian Anderson con Associated Press. I'm Brian Anderson with the Associated Press. Thanks for taking my time and taking my question here. First, for Dr. Cohen, thank you so much for releasing the county level data with cases and deaths, and I wanted to follow up with your office for one more thing on that, just to see if there's an easier way, more digestible way to get it. But my question for the Hispanic community is just sort of with regard to the disproportionate impact that we're seeing around COVID. I was hoping that with the latest uptick, maybe you could speak to whether it's getting worse over time for the Hispanic community. And also, I was just curious, many of these members of the Hispanic community work for meat processing plants or other factories. Have there been any enforceable fines or steps taken against some of these employers who have potentially endangered the safety of their workers? Thank you.
Well, Brian, first, thanks for the question. I want to turn it over to our guests, in particular, Dr. Martinez Bianchi, for really to give you a better perspective on what she is seeing in our Latinx communities. But what we have seen in our numbers here in North Carolina is that early on in the outbreak of COVID-19, we actually saw our original cases really linked more to people who were traveling. Then we saw more of those cases in more recent weeks and months related to some of our historically marginalized communities, as we've talked about. Those who, while many of us were able to shelter at home, obviously couldn't and were working in essential businesses, have more exposures, and I think that is what we are seeing now in the numbers. But let me turn this over to Dr. Martinez Bianchi.
Thank you, Dr. Cohen. Brian, thank you for your question. You were asking, are we seeing, as clinicians, seeing people with COVID-19, are we seeing increasing numbers? On the front line, we are seeing increasing numbers, and we're also seeing it in data. In the county of Durham, for example, at this point, last month they were about 67% of the cases. This month is 79, almost 80% of the cases. So of those with positive testing. But we're also hearing on the phone many members of families who are all of them getting sick, passing it from one person to another. We're also hearing about the fear of getting to the hospital, the fear of being separated from their families, the fear of not getting to see them ever again, the fear of having to pay a tremendous amount of money to be able to be cared for. So we spend a lot of time on the phone trying to assess what is going on, how sick are they, can they access a respiratory center? And we are not seeing enough clarity from different health systems about where can people access and will they be able to get the care they need without having to pay when they don't have insurance or they don't have the means for the costly care that this entails. You mentioned about sources of infection. We did talk about meatpacking plants. We saw it happening. North Carolina has been reported to have had 23 different plants with outbreaks, and most of them, many of them employ members of the Latinx community. One of the things I have seen as a clinician that maybe a number of cases are reported for the workers in the plant, but we don't hear of the reports of the family members that were also affected. The 2 members of the company that got sick but then took it home, and then 7 of their own family members. So maybe there is a report of 50 cases, but there's 200 members of that community that were affected through transmission. This is why we're advocating so much for the use of masks. I really think it's an important issue to think about. The mask is not a political event. The mask is a public health. It's me protecting you from getting sick and having others protecting me from getting sick from them. So I hope this helps to answer some of your question.
Terrific. Thank you. Next question.
We have a follow-up from Brian Anderson with AP.
And sorry, for Dr. Cohen, I know there was the racetrack over near Burlington that was shut down. Has there been any sort of enforceable fines or actions that your department has taken with regard to employers that might have endangered the safety of certain members of the Hispanic population?
So I think you're referring to the legal action that we took with a speedway, and yes, they are continue to be enjoined from further races because, again, that we felt that was a public health concern there. Obviously, we have a number of rules and restrictions in place to make sure that we are trying to keep the spread of the virus level low. I think I want to make sure we're making the connection that it takes all of us, not just one particular community, but all of us to keep that virus level low. So when the governor earlier this week asked for us all to wear face coverings, that is protecting all of us as well as those in some of our higher risk work settings, like a meatpacking process or a long-term care setting or a grocery store. It's going to take all of us working together to wear face coverings. It's a simple tool, but it's something that works. The science tells us it does, and it's something that we can do to protect our public health, but also protect our businesses. So that's the thing that we are focused on to make sure that we can not only protect our Latinx community, protect all of us here in North Carolina. Thank you.
Our next question is from Aaron Sanchez Vieira with the News and Observer.
Yes, hello. Good afternoon. Muy buenas tardes a todos. Secretary Cohen, thank you for taking my question. My question was about the agricultural farm workers who are mostly Latino immigrants in North Carolina, specifically those who are foreign guest workers through the H-2A visa program. I wanted to ask what the progress was from the governor's office as well as the State Department of Health on meeting some of the demands from the Farm Worker Advocacy Network concerning protections for workers during COVID-19, protections for their housing, and also including protections for the upcoming hurricane season, such as evacuating them. There's a range of concerns that are expressed for the farm workers that harvest our crops and handle tobacco, sweet potato. I wanted to know what's in store for handling that very important part of the Latino population in North Carolina. Thank you.
Thanks for that really important question. Yes, we have our agricultural space in North Carolina is not only important to our economy here in North Carolina, but around this country. And we need to make sure that we're protecting the workers that are there in those farms. They come to North Carolina sometimes for a short period of time, and we want to make sure that they're as protected as we can. I will keep going back to some of the protective measures that we put in place earlier this week around the requirements on face coverings. Those are required in not only in public settings, but in particular work settings, and we were sure to call out agriculture in particular, as well as when folks are in congregate living settings, as well as on transportation, like large buses, private or public. So really, as I want to to go back to have Dr. Martinez Bianchi share with you the importance of those face coverings as first prevention. So that's the top thing. We want to prevent the spread of this virus. And again, it's not any one community that needs to do this. We all need to. But then it's about how do we ramp up testing, contact tracing, and then you are right about the isolation support. And we were talking earlier about the importance of making sure that we can have housing for folks. And that is where we're doing some additional work with our counties and here at the state level to make sure that we can meet the needs of our farm workers. But let me see if others want to say anything in addition.
There was a study published this week by Duke.
Okay, hold on.
I think it's important to refer to a very important study published this week at Duke University, and unfortunately I don't have the names of the authors, but it's very interesting to see the curves of what happened once Duke instituted universal masking, where every employee at Duke has to wear a mask at work. And we saw that the transmission was going up and then flattened completely as people started wearing masks. We saw it among health workers in the institution stop getting sick from coronavirus by using the mask in spite of actually seeing people that may have coronavirus coming into the institution. There's really, the use of the mask is really the most important measure at this time. Thank you.
We do recognize that the farm worker industry is important for us, it's important for the state of North Carolina, but I think now more than ever, I think what we need to do is to integrate all these farm organizations that are getting support from the state, to integrate other organizations to address the issue. I think this issue, as the Secretary had mentioned it, is across the board, it's impacting everybody, it's every single community. Here, our main focus is working with the Latino community, but I think now more than ever, we had to integrate all the different organizations across the state that work in specific with the Latino population, regardless of what industry, what communities, but all we need to come together.
Well said, Juvencia, thank you. Next question.
Our next question is from Rafael Prieto with Que Pasa.
I am from Que Pasa, mi gente in Charlotte. Hello, Pilar. Hello, Juvencio. The situation here in Mecklenburg County is like in other parts of the state, very bad for the Hispanics. We are 14% of the population, and right now we came to close to 40% of the cases. In question of death, 78 have been for white population, 40 for African Americans, and only 12 for Latinos. But in a recent Zoom meeting with the Hispanic leadership, with the local authorities, the leadership stressed the situation or present the situation that none of the measures by the state are enforced, and none of the local measures are enforced. They were asking for the police and for the authorities to find the people that doesn't comply with those measures. to find people, ticket people that have parties, that and even it's a suggestion to find the people that doesn't use the mask right now. I want to know if the state plans really to ask local governments to enforce the measures by Governor Cooper.
Well, Rafael, thanks for that question. And so, yes, as you were referring to on Wednesday, Governor Cooper did issue a new requirement for people to wear face coverings in public spaces, and there is an enforcement on that for our businesses, particularly in retail, in restaurants and other public settings. The enforcement is on the business, and we ask all of our local law enforcement partners to work with us on this. They are the ones that enforce our rules and our laws. This is an important public health effort. You've heard it from Dr. Martinez-Bianchi all afternoon. It's an important public health rule, and we especially hope all of our law enforcement partners are going to work with us to make sure that this is taken seriously. But I also encourage our local leadership to model this and making sure that they are showing their communities that this is a really important public health tool. I think you're seeing today that not only North Carolina numbers we have been talking about have been going in the wrong direction, but we are seeing states around us really see some severe increases in their numbers, and they're having to go backwards, actually, in their easing of restrictions, and I don't want to do that. And we have a tool here that we can all use together in terms of face covering, so it's important for us all to work together on this, and we are going to continue to do this. And I appreciate the support of all of the leaders across North Carolina, whether they're elected or local law enforcement, they're in the business community, entertainment community, and the Latinx community. We all need to come together on this important issue of wearing face coverings so that we can make sure that this virus does not spread across our state further, and that we can get back to the things that we want to do, like sending our kids to school come this August and this fall. So that's the work we're going to focus on. Thanks so much for the question.
Our next question is from Rose Hoban with NC Health News.
Hi, Secretary Cohen. Good to talk to you. I have a couple of questions. The first one is about some surges. You know, do you have kind of a working hypothesis as to why we're seeing the surge? Was it protests, both Reopen NC and the Black Lives Matters protests? Was it the, was it things like Ace Speedway? What is it more based on industry? What's your working hypothesis around this?
Thanks, Rose. So we are trying to dive into our numbers more. I think what we shared earlier in the week, that we're seeing a lot more cases in our younger population. So 18 to 49 is where we're seeing a lot more of our new cases. And we think that is related to a lot of the reopening. We know folks are moving around more. When we look at our movement data here in North Carolina, folks are moving around and the virus is moving around. We haven't seen yet in our data anything related to protests specifically. But we have been seeing our numbers go up. That really has been since the start of our phase 2 of easing restrictions. Folks are moving around more. We're doing more things that we all knew were higher risk. And again, I think it goes back to this conversation we've been having about the numbers we're seeing in our Latinx community. There are folks who don't have the opportunity to stay home like some of us do, and are out running essential businesses and working every day. And as more virus moves around, that means everyone's risk of exposure when they're in public spaces goes up. And it's exactly why we took the action we did this week to require the face coverings in public spaces, because we are seeing just more virus in our community. What I would say is we're seeing more community spread, meaning that we can't link the case back to a specific circumstance or setting that we knew they got exposed. And it just means the virus is out there in our community, which is, again, why we took the step to move to these face coverings. And again, they work. Dr. Martinez-Bianchi was saying that the new studies coming out every day about how they can flatten the curve or slow the spread of the virus, and that's why we implemented it this week.
And we'll take our final question today from Corinne Villalobos with La Conexión.
Good afternoon. Thank you for giving us this opportunity to speak to our authorities today. As we have said, our community has suffered from this pandemic. They have had to pay rent, they have no benefits, and they are afraid of reporting sick because they don't have money to face medical expenses. My question is there a possibility that Latinos with COVID-19 will be seen in hospitals without paying?
So let me say a couple of things about access to care. And I think COVID-19 is shining a light on ongoing inequities that we have seen in our state and in our country for, unfortunately, a long time. We know that there is a higher uninsured rate amongst those in our Latinx Hispanic communities, amongst our African American communities. And unfortunately, North Carolina has not taken the step forward to expand Medicaid. We know that expanding Medicaid could have gotten 500,000 people access to insurance coverage, and we do not have that tool here, and that is unfortunate. We were going to continue, the governor and I, to work with the General Assembly and try to help everyone understand why that's such an important tool now more than ever to have here for our state. We need to get people access to insurance coverage. It's something I've talked about well before COVID-19, but now in the middle of a crisis, we need that tool even more. Not only do we need it so people can access the testing and the care if they get sick, but we know COVID-19 can be more serious if people's underlying health conditions are not taken care of. So if they have diabetes and it's not under control, they have high blood pressure not under control, asthma, we know that those are things that are going to impact someone's ability to fight off COVID-19. So insurance access is incredibly important, but we don't have that tool here, so what are we going to do about it? We're going to use all the other tools at our disposal, whether it's some one-time money that we're allowed to use related to getting testing and access to care through CARES dollars, federal dollars, and state allocation of those dollars. But there's a lot more that we need to do here, not just for COVID-19, but to make sure that folks have access to care regardless. I want to make sure our other guests have a chance to weigh in. I don't know if Dr. Martinez-Bianchi, but I know others would want to say something about the importance of access to care, particularly during this crisis. Thanks.
Thank you, Dr. Cohen, for allowing me to make another comment. I think there's also an important thing, if I had the opportunity to speak to health systems in general. Most of the planning that I have seen around COVID-19 has centered, and this is all over the country, has centered in the intensive care unit, in the number of respirators. And we have forgotten that coronavirus 19, that COVID-19 is a community illness that is spreading in the community. And there needs to be a plan that actually gets the care into the community where the community is living. When we look at mappings of where the test centers are, they tend to be in the most affluent communities, the most affluent neighborhoods or of a certain city, forgetting those areas of the city where people really need more access. I have talked to patients of mine that will need 3 buses to get to a drive-through, and then the drive-through needed a car, so they wouldn't be able to get to that test in the car. Even when new testing sites came in through corporate pharmacies, they also were located not in the areas where these more vulnerable communities live. So there's a really important moment to actually implement targeted testing in the areas where we're seeing outbreaks so that we could actually really see where is it happening. We have the opportunity to do targeted mobile testing, taking a van and a group of people who are trained to do the testing and getting a whole neighborhood, a community, a church community, a faith-based community, or whoever is seeing that there is an uptick of the virus. And then there is a need for respiratory centers and places of access to the care that are closer to the community. Our federally qualified health centers are being overwhelmed to provide the care of people who also have lost jobs and have lost insurance. And so we really have to think of this as a multi-sector collaboration and multi-sector partnership that really gets us all together, like Juvencio said, and like Pilar said, and Dr. Cohen said. We have to really get all of us together to get the testing closer to those communities that are being more affected, to get the care closer to the community in centers that are within the neighborhood so that they can access and get the care that they need. Thank you.
Thank you. And I think also it is very important to have culturally appropriate services for the community that they can really access to it and have people they can trust so they can really take advantage of what is out there. Because we see even with testing, sometimes they are asking for IDs, or you have to go to a website, fill out a form on the computer, and that's not something that is helping our community. So we need to really be careful about giving the possibilities, the access to healthcare, but also to culturally appropriate access to healthcare.
Great. Well, thank you, Pilar. Thank you, Dr. Martinez-Bianchi, and for Juvencio. Thank you for joining for this very special discussion today and a focus on activities in our Latinx Hispanic communities. But I want to just end and remind everyone that it is all of our actions that help all North Carolinians to be safe and healthy. I want to remind you that the requirement for face coverings does go into effect today. I hope that you didn't wait for today and the requirement, and that you are already putting this in your purse or your pocket or your car, and then when you're grabbing your keys, you're grabbing a face covering, and that you're wearing it every time, because the science shows that it really only really works to slow the spread of the virus if we all do this together. Remember, as North Carolinians, we're strong, we will get through this, we are resilient, and we'll care for each other. Thank you, and have a good weekend.